Welcome to DC2B Revolution, helping chiropractic students think big in order to live large. I'm your host, Noah Volz, and today I'm here with Dr. Shawn Thistle. He's a practicing chiropractor, educator, international speaker, and also the founder of RRS Education, which we'll talk more about in this interview. But the basic gist is it provides evidence-based, clinically applicable information for chiropractors and other manual therapists. He's lectured as a part-time faculty member for the Canadian Memorial Chiropractic College, predominantly in orthopedics. And so, has a vast amount of knowledge. We're really thankful you're willing to come on the show today. Thanks for being here, Dr. Shawn Thistle.
Oh, thanks for having me, Noah. It's nice to chat with you. And I've enjoyed watching your interviews as well.
You got to take a look at some of those. So, the initial way that I came across you is I came across a video that you did talking about the common myths in chiropractic. And most of this was new information to me. And so I wondered if you could kind of break down what those myths are, and then also give your perspective on how you think those myths are affecting the chiropractic profession.
Well, that's a big question. That video was, if you'll allow me, I'll give a bit of a backstory on where that video came from.
Please do. Yeah.
Because it got a lot of really kind of good attention, and then sort of generated a lot of sort of hate and chiropractic vitriol coming at me as well. So that was meant to be an introductory video to a much longer interview that I did with a group called Functional Media. And that's a company that was started by two recently graduated physiotherapists. And their angle was to interview people in the manual therapy space, be it a chiropractor, physio, or whatever. And, their spin on things is they're media generating people. So they work on presentation styles and graphic design and that sort of thing. So we did about an hour audio interview where we got into a lot of these things in a lot more detail and scope, in a sense. And then the video was done as a kind of teaser for that interview. So in a way, I stand behind what I said, but some of the context was lost in translation there, unfortunately. And I go into a little more detail in the video. So for some of the conversations, if we can call it that happened on social media, I would try and refer people to that interview to get a little more scope and insight. But I really just mentioned a few things that, bother me from an evidence perspective, but I think also bother me from a patient management perspective, and how it boils down to our cultural authority as a profession and how the world kind of views chiropractors and chiropractic. And so the one thing I talked about a little bit was body shaming. And I think I probably stole that from someone else. I don't remember when I started saying that. And every idea these days is just a good recycled idea from someone else, quite frankly, as you know. But I talked about little things and little asymmetries that people may have, a little bit of a low shoulder here or tiny postural change, and how some of our colleagues really frighten people into long-term care plans based on those findings that may or may not be giving them symptoms anyway. That was a little bit controversial for some people. And, most of those, just to clarify that point, because some of the things that people were saying back to me were, well, a leg length inequality can certainly cause problems with people if it's significant. And I certainly agree with that. And I didn't say that it couldn't, but a tiny leg length inequality that was probably there for the person's whole life and they have no symptomatology is no reason to treat them forever to try and correct it. Human bodies are wonderfully adaptable, right? And we kind of live with our own asymmetries, and most humans aren't symmetrical anyway. So I kind of refer to that as anatomic body shaming. It's making a patient focus on something that's probably irrelevant to their general state and condition, and whether or not they have neck pain and so on. There's so many other things that we can effectively educate patients about in terms of lifestyle and activity, that having someone worry about my one shoulder happens to be lower than the other, or my one foot rotates out a little bit more than the other, I'm not so sure we're spending good clinical time there. And I've had patients come into my practice over the years saying, I saw another chiropractor and they told me X, Y, and Z, and it really freaks people out. And I know Bobby maybe talked about this as well in your interview with him. Our language really matters in terms of what we say to people. And I would respectfully argue that a lot of people who focus on things like that are doing it with the ulterior motive to get the patient to commit to a care program. And I just don't think that's right. So that was one of them. The other thing I touched on.
Just to touch on that real quick, because I wanted to clarify in terms of posture, right? I mean, posture does make a difference depending on the posture that the person is having. That can create some sort of asymmetry or repetitive stress that can lead to a certain type of injury. And that definitely could warrant chiropractic care. But you're talking about these really minimal variations of, symmetry that all of us have. I mean, there's not a single person that is 100% symmetrical, and using that as evidence for a course of care that may not be warranted. Is that a correct understanding?
Exactly. And that's part of the context that was lost in the brief nature of that video. So that's a valid point. And of course, posture can matter. I never said it didn't. But that also boils down to changing someone's posture is an interesting concept, isn't it? Because is that something we do via spinal adjusting? Or is that something that we do via repetitive movement, grooving and training and postural awareness and that sort of thing? So there's a whole rabbit hole to dive into there that, it makes people really upset to kind of challenge long held beliefs. But in a lot of these cases, there's simply not much evidence for an approach like that. So that's where I'm coming from. We have a lot of great evidence to stand on and a lot of patients that really need our help these days. So there's lots of work for all of us if we put our focus in the right place, and we don't need to scare patients into seeing us anymore. I don't think it's right.
Yeah, I completely agree with that. And, I think it's good to look at the evidence, because like you said, there's plenty of things that chiropractors treat really well. And so let's focus on that instead of, maybe some of these other things that we're extrapolating. So what's another one of the myths that you brought up in that video that you got a little blowback from, that you clarified in your longer series?
Well, I don't actually, now that I'm thinking about it, I'm not sure we talked too much about it in the audio version, but in the shorter version, I mentioned serial X-raying of patients to monitor progress or changes in static posture, for example. And really, that's one of the most guideline discordant, unnecessary things that chiropractors do these days. And that really bothers some people. And the standard reply you get from the vast minority is, well, what about CBP and the Harrison's work? And yes, they've published some things. I would respectfully suggest, and I'll get blowback from this too, that a lot of people who have gone through and taken that program have not bothered to read the reference list that's provided to them. It doesn't necessarily say exactly what they're telling you it does. That's buyer beware and reader be educated. So, but I would also say that what it boils down to for me, regardless of the quality, nature, or substantiality of their body of work, does serial X-raying of patients change outcomes for patients? And I think the answer to that is no, because we know that chiropractic, as you said, is very helpful for a number of conditions, but a lot, in fact, the majority of chiropractors who successfully treat patients do not serially X-ray their patients. So are those outcomes some, stroke of luck that's happening in all of these chiropractic offices while this minority of our colleagues continually X-ray people? I'm just suggesting that it's not necessary for good patient outcomes. And, the other part of the blowback you get is people get very personally defensive about that sort of thing. And I understand that. We're a really kind of insecure bunch of people. But I don't, I want to be very clear that I'm not suggesting that people that practice in those techniques don't help their patients. I never said that. There are very well-intentioned doctors that are giving very good care, They're probably wonderful adjusters, and I'm not saying that they're not. I'm just saying if we back up for a second and look at the clinical guidelines for the conditions that we're seeing the majority of our patients for, serial imaging is not necessary to achieve the good outcomes that we're all getting anyway. So I guess that's the best way I would sum it up. And I know even saying it that way is just going to make everyone angry. So we'll see what happens.
I've definitely had friends who personally have taken offense to that, and many of them are upper cervical docs, which rely quite a bit on taking X-rays in order to get a baseline, in order to monitor the course of care.
Right.
And so it is one of those things that everybody is going to have kind of their different perspective when it comes to X-rays. But, as you pointed out, I think it was in your video, like, we're the only profession that is using X-ray in that way. Everybody else is using X-ray basically to diagnose, pretty severe conditions, severe radiological conditions. And even, other countries require a significant understanding of radiology in order to ensure that when you're providing care, you're not, going to harm anybody. That seems to be kind of the mainstream use of X-rays. Would you agree with that?
Yes. And that falls in line with, globally published clinical practice guidelines on spinal pain syndromes. It's just a problematic approach that, again, doesn't necessarily lead to better patient outcomes. As I said earlier, I bet a lot of the docs that utilize that technique could easily not X-ray the next 10 new patients they have and get exactly the same wonderful clinical results. So I'm just suggesting that, Dr. Pearl mentioned in his interview that we have to be team players to advance our profession forward in the sporting realm. But we have a big choice to make right now about whether we want to be part of the healthcare realm in general. And part of that is not coming out of left field with an approach like imaging everyone to look for things that no one else in the world looks for. We don't need that anymore to make us distinct and important. We have a lot of other good parts and components of our profession to stand on in that sense. So maybe I'll leave it at that.
Yeah, sometimes it's better to just, put it down.
It's better if I just stop. Yeah.
But one thing that you said that, reminded me, this is kind of extrapolating quite a bit, but it reminded me of a book I read by Sheryl Sandberg, who's the, chief operating officer of Facebook, called Lean In, where she was talking about, women's place in the work environment, and how if they just lean in to this kind of current environments that's there, then they can get acceptance and then work to change things from the inside out, once that acceptance is there. And so one thing I was kind of hearing from you is, in leaning into evidence-based practice and kind of medical model as it is, then the acceptance is there. And once we're accepted as a profession, as part of that integrated whole, there's a lot more opportunity for, doing more innovative stuff. Was I hearing you right?
I couldn't have said it better myself. I mean, the world of healthcare and the nature of big data and projects like the Global Burden of Disease, for example, that publishes on conditions that disable and kill human beings and cause problems with human beings, is basically providing us with a roadmap for our profession for the next 50 years. There's a spinal pain crisis around the world. Neck pain and low back pain are the most disabling thing on earth. So I think people who live on the fringes of our profession, on both sides of that fringe, for the record, are missing that opportunity. In order to have a profession, we have to solve a societal problem. And there's one being just laid out right in front of us that we happen to be really good at, that we can provide a viable solution to in combination with exercise and manual therapy and spinal manipulation or adjusting. And getting hung up on the difference even between manipulation and adjustment, for example, is just, it's navel gazing. It's just, I don't understand why we're doing it. We have so much of a good reason to be very much involved in the healthcare discussion these days, that the rest of it is just superfluous. And we waste time on issues that really don't matter, while this huge opportunity is just driving right by us. So I don't know if you were at DC 17 in Washington. I didn't know you at that time. But Jan Hartwigsen did a keynote speech on the Saturday morning, and he was discussing this and put up a picture of a soccer match where someone was getting ready to take a penalty kick and the goalie wasn't even in the net. The goalie was not paying attention and was out of the net. So this guy was taking a penalty shot on an open net, and he was basically saying, this is our opportunity right now to take charge as spinal pain experts. And some people would come at me even for saying that and say, well, we're not pain doctors. Well, why not? Pain is a problem these days. There's an opioid crisis. Governments, insurance companies, and healthcare systems are looking for viable solutions, and we have one. So, looking at, every time I lecture at CMCC in Toronto, I look at the students and think to myself, I've had a great career in practice. I've evolved it into doing some other things in the education space. I do medical legal consulting. So I'm a bit of a hybrid in that sense. I do a bunch of different things. But it's partly my responsibility to ensure that your generation has something to do when you're out in practice. And the stars are really just aligning for us nicely in terms of society realizing that there's a problem that we can help with, the evidence coming in to support us in helping with that problem, and a public desire for a non-invasive, non-pharmaceutical-based treatment approach for that problem. So it's never been a better time to be a chiropractor, I think. And I said that to the group of students in the Student American Chiro Association last night. I did a webinar for them. It's really an exciting time to be going through Chiro College. You guys are coming out into an awesome environment for us if we play our cards correctly.
Yeah, I mean, I completely agree with that. And I was a body worker doing predominantly myofascial work for the last 8 years before I went to chiropractic school, partly because I saw that opportunity in terms of the diagnostic criteria and assessment that I'm able to implement as a chiropractor, up-leveling the amount of care and the patient outcomes that I would be able to get. And that was really inspiring to me as a massage therapist. But I wanted to, kind of focus in on what you said, like with this great opportunity and with all this young blood coming into the profession, excited, motivated, inspired, wanting to make a difference. What do you have any recommendations for students in terms of how to kind of take this opportunity by the horns and steer the profession in a direction that's going to ensure a good livelihood for every student coming out of chiropractic school?
Wow, that's a big question, isn't it? That's a tall order. But here I'll touch on a couple of things that I think are important in that sense. You have to come out into a practice environment, and Bobby maybe mentioned this in his interview as well. The world doesn't really owe you anything when you get out into practice. And I know that's hard to hear for students because you've worked so hard to get to that level. But I think a lot of chiropractors tend to waffle out in practice and struggle a little bit because they're unwilling to commit and stay the course and practice the way that they want to practice. And there are a variety of different practice styles. We all know that. But you have to be true to yourself in terms of what makes sense for you as a human and a doctor and someone that's going to take care of your patients, and also what makes sense for your family environment with your partner, your spouse, or whatever. And you also have to realize that a practice cannot be booming and full and profitable right away. Those scenarios are quite rare, regardless of what anyone tells you. Growing a practice that will survive in the long term takes a lot of hard work, a lot of hustle, a lot of patience, and a lot of patience. Do you know what I mean? There are two different types of patience there. So I think it's staying the course and being true to your education. And you come out of chiropractic college these days armed with a lot of clinical knowledge and not a lot of treatment experience. So you have to be okay with the idea that your treatment style will evolve over time and your doctoring style should evolve over time too. The other thing I would say that I find students struggle with a little bit, particularly when they're new, is to be a good doctor and be a good chiropractor, you have to be amazing with your hands, but you also have to be amazing with your ears. And I think listening to patients is something that we fall short on sometimes. And taking a good history and being present and having a good conversation with people. And I know numerous, guests on your show from all walks of chiropractic have mentioned communication. And I would certainly echo that as a skill set that we have to be very good at. But also remember that communication is a two-way street. Some chiropractors think communication is a one-way street of them telling the patient the doctrine of chiropractic or whatever it is that they want to tell them. But there's a lot of valuable information to be had from the things your patients are saying to you. And the first visit, you have to nail that. And, one of the most common complaints people have about healthcare providers in general is that they didn't listen to me. So don't be that doctor. There's a therapeutic benefit to having a patient tell you their story. There's a therapeutic benefit to touch. There's a therapeutic benefit to empathy. And there's a therapeutic benefit to the contextual factors around a clinical appointment. And I think we're in a primary position to nail all of that and just be really good at it. And most people love their chiropractors. And I think that's partly because we're really awesome at that sort of thing. So I think students and new grads really need to embrace the personal side of our profession, be good listeners, and just be, you're there to serve and help the patient, not serve and help your bank account. And if you do the first thing well, the second thing will take care of itself, I promise you.
Yeah, thank you. I mean, I totally agree with you. Having that long-term vision in mind, I think so many of us are kind of stuck in thinking about today, maybe thinking about this month, maybe thinking about this year. But really, when you look at the trajectory of an entire career and you look at this is something that you're doing for the next 10, 20, 30 years, depending, that you're going to evolve, you're going to change, you're going to, learn new information, integrate new information, and having that kind of long-term mindset, I think, is key. And in terms of communication, you nailed it. That's something I hear every single interview is that, how you communicate with your patients is so important. And like you mentioned earlier, the words that you use with your patients today are going to represent the profession as a whole. It's not just the communication between you and that person. Everything you say to that person, they're going to say to their spouse, they're going to say to their coworkers, and that's going to extrapolate out, and you're creating their picture of chiropractic.
And, all of that ties into our cultural authority and what people think of us. And, combine that with the opportunity I outlined earlier in terms of the amount of burden, the amount of evidence we have to support our ability to assist with that problem, and the public desire. I mean, it's a really key time for us to get this right. And, the one other thing I would add for a new grad, and this is someone told this to me before I started, and it was absolutely correct. The first 50 to 100 patients that you see are going to fill your practice for the rest of your career. But they can't fill that practice if you keep moving around and trying different offices and don't stay the course. And I practiced full-time for about 12 years before I backed off to do some other things. And I still go and see patients for home visits. I'm going to see some patients tomorrow. So that's sort of the mode that I, see patients in as well. Because I would miss it if I didn't do it. And I think it helps me give a bit more meaning to all the other things that I do. But I treat a lot of patients over 12 years. And if I think back, most of them came from that original group. So just treat them like family, and they will fill your practice with referrals. And then you don't have to worry about practice management crap and all that other stuff that promises everything and provides nothing for the most part. So just work hard. Work hard for your patients. I say it at the end of every one of my recordings on, we post research reviews every week, and I record them for our subscription service. And I say at the end of every one, work hard for your patients. And I mean that. And if you do that, they'll reward you for sure.
Yeah. And, we talked pre-roll just briefly about, I had my first couple outpatients, and for me, in terms of learning, there's nothing more motivating than that experience of having the person with this condition that I've studied and learned about in front of me their story, and expecting, me to be able to help them. That just made me want to hit the books 10 times harder, because this is a real person in front of me. And so, there's nothing more motivating than patience, I think, if you're really
And it's
really
exciting in that sense. But what you'll also realize quickly is that patients don't read the books, right? They can come in with whatever they want, and you'll realize that variability is the norm in human beings. And it's really nice when a patient comes in and checks all the diagnostic boxes for a specific thing. But these days, patients are complicated. Not many people come in with one specific problem. They have a lot of things going on. And that represents a significant challenge for us going forward as a profession. But I've always kind of enjoyed that diagnostic chase and getting to the right answer and figuring out what works for an individual. We have to be adaptable to the patient sitting in front of us. It's not a cookie cutter approach to how you should do things. And every patient needs something different from you. And the challenge as a good doctor is for you to figure out what that thing is and use it to your advantage in a good way for that patient. So, that just comes with experience, I think. I don't think anyone can teach that. You just have to develop that over time. And part of that comes from using these things. They'll tell you what they want, right?
Yeah, completely. And like you said, you just have to listen. Yeah. Well, I know that, students, other doctors who are watching this are going to want to know more about you and what you're doing and, hone their communication skills and, develop that opportunity that's happening right now in spine care, help to develop our cultural authority as a profession. So, what are the resources that you're providing that can help them get there?
So what I've been working on since about 2006, and what I now work on full time is RRS Education, as you mentioned earlier. You can find out more information about it at rrseducation.com. And what we provide is a subscription-based service where we post weekly reviews of current research and help clinicians apply it to practice. We've been doing it for a number of years now. We have over 750 reviews that are categorized by clinical topic and body region and that sort of thing. And it's not meant to be, I don't think any product or service can give you an overview of all of the literature all the time. But subscribers to my service, and we have subscribers in 15 countries. The Canadian Chiropractic Association subscribes for every member in Canada, over 8,000 doctors. So we have big groups on board looking at this, and the content is written by clinicians for clinicians to help us apply evidence to practice. And it's meant to give you a slow trickle of information each week, just to keep your brain muscle working and help you integrate current evidence into practice. We also offer e-learning options. We have online courses that are available, and we're working on more webinar style, more interactive courses at the moment. And I also do seminars throughout Canada where I meet with groups of colleagues and we discuss evidence and clinical application and go through cases and stuff. So I like to do the speaking, and that branch of the business is exciting, and I get to see colleagues mostly in Canada now, but maybe I'll end up down south of the border someday. And I do conference speaking and like I said earlier, a bit of medical legal consulting as well. So I like the mix of things I do. I still love seeing patients, but I think my real drive and energy and my passion is for knowledge transfer and helping chiropractors integrate the amazing evidence we have now into patient care, and also advocating for us at government levels and at a health system level and so on.
Yeah, thank you so much for, all the synthesizing and consolidation of all of this evidence and this research and being able to provide it in this, digestible format, and continuing to, educate people and advocate for the profession as a whole. I really appreciate all the work that you're doing. I think it's, it's a really important, purpose that you've laid out for yourself. So you're welcome. So this has been a production of DC2B Revolution, helping chiropractic students think big in order to live large. If you like this video, let us know, comment on the video, or subscribe to the channel. And Dr. Shawn Thistle, thanks so much for being here.
Thank you, Noah. Have a great evening. Thanks everyone for listening.